So what I'd like to do is go ahead and introduce our first speaker. She's standing right behind me. This is Dr. Emma Abramyan. She's a graduate of the University of Pacific Arthur A. Dugoni School of Dentistry. She is a member of the American Dental Association, California Dental Association, San Mateo County Dental Society. She is a volunteer for Project Homeless Connect, 1,000 Smiles Mission Project, and she practices general dentistry with an emphasis on integrative, holistic treatments. She also very much likes aesthetic dentistry to help patients with a beautiful smile. And with that, please welcome Dr. Emma.
Thank you for permission. Today we're gonna talk about biological dentistry. We can use the word holistic, integrative, but pretty much I use them interchangeably. I do practice in Bay Area for quite a while, and last couple of years it's been only holistic and biological approach, and I'll show you the difference. Let's start with the terminology. What is biological dentistry? Biological dentistry concerned with the whole body effects of dental materials and techniques that we use. It takes the advantage of conventional dentistry and adds to it wide array of new techniques and materials. Biological dentistry acknowledges, appreciates the connection between oral health and systemic health. So how is biological dentist different from a conventional dentist? So first of all, we don't use amalgam fillings. Not only that, we also use safe protocols how to remove them safely for environment, for our dental teams, and for our patients, of course. We test individuals for biocompatibility, allergy, and other reactions to all the materials that will be inserted in their mouth. We don't use fluoride. This is a big one, and we're going to talk about it, why. And a lot of times, the traditional approach of having a diseased tissue, having a cavity, let's just cut it out and pretend like nothing happened. It's a pretty old model. We try to regenerate diseased tissues. And of course, the approach is minimally invasive, which means more kind, a little gentler. We very much try to conserve to structure. And as I said, we try to regenerate. We use a lot of air abrasion we're going to talk about, and focus on prevention, remineralization, healing, and consider biology of an individual mouth. So I talk to a patient and I look at his mouth. We talk about pH, we talk about nutrition counseling, we talk about saliva, medication the patient takes. It's a very individual approach. And of course, we're trying to address the root cause of the problem. Just another note, biological offices are fragrance-free. Why? A lot of patients that we see, they have very high candida levels, and they feel sick. They're very sensitive to perfumes, to hairsprays, to lotions, and we always ask the staff or our team, please avoid it. Now, we also have a lot of tests. So as I mentioned before, biocompatibility. So let's say we have a patient, and I practice in Marine, and we have a lot of patients with Lyme disease. And the patient will come, will say, I'm very allergic. I always have reactions to different materials. I want to make sure what you use is different from other dental offices. So we refer them to biocompatibility. So there's a list of materials, meaning anesthetics, filling materials, crown materials, cements, pretty much everything that will be inserted in the mouth can be tested for. And there's a data, nationwide data for that. And those are just a couple of tests. So let's say we had a patient who came and said, my dad had an oral cancer, and I want to make sure I'm not at increased risk for oral cancer. How do we test for it? So there's a special DNA lab. We take a swab, saliva test, and we will know what are the risks are. Now, a lot of times we have a hygienist, of course, and a lot of times I will stop by and do an exam. At those hygiene checks, we always talk about flossing. And we know people, generally speaking, hate flossing. And this is where we have the long conversation about the consequences of not flossing and oral hygiene in general, not just flossing. But if if before I would always joke with patients if they will ask me, do I have to floss all my teeth? I will say, no, only the ones you want to keep. So that's the conversation before. Now it's shifted a little. Now this is what we talk about: heart infection, heart attack, lung infection, strokes. I know it sounds scary, but this is what it is. Think about it. Flossing alone can reduce glycemic level, meaning reduce your sugar level. All this bone infection, blood infection, degenerative disease. This is a big one. Oops, sorry, wrong one. Degenerative disease, autoimmune disease. So yes, you have to floss. You have to use water pick, and I can't stress it enough. Now, think about it. Teeth are organs. They have their nerve supply, they have their lymphatic supply, and blood supply. And another question I get from patients: so why my teeth feel so gross in the morning? So if you think of a teeth as an organ, and there's outward motion of lymph and blood, in the morning the body itself and teeth as such will try to detox, meaning the toxins will be flushed out to the surface. This is what we feel when we wake up in the morning. So that's why ancient Ayurvedic tradition of oil pulling, such a fantastic detoxification kind of start for the morning. And I always recommend it to all my patients. And it's just simply done by squishing your mouth with a tablespoon of oil, usually coconut oil. Yes, just 10-20 minutes, you squish with the oil, you spit it. Never use your sink because you're going to clog your sink. So use it in a trash can. And the longer the better. If you get to 20 minutes, it will be only to your advantage. Now, we obviously have to talk about medications and supplements. And this is at the intake appointment. This is where we usually point it out. So if patients take certain drugs, we do know they lack some nutrients. There's some examples here. So acid blockers, they decrease folic acid absorption. So we say you need to take folic supplements. The big one is NSAIDs, non-steroidal anti-inflammatory drugs, acetaminophen, ibuprofen, our favorite Tylenol and Advil. Guess what? We need to take folic acid. We're depleting our body of this nutrient that's pretty much basic to all the metabolic reactions in the body. Now, antihypertensive diuretics, they dry the mouth. They promote bad bacteria growth. They promote gum disease. They promote mouth breathing. And another big one is statins. So patients who use statins, they need to take CoQ10. And CoQ10, now we know, the research shows, it helps cardiac tissues and gingival tissues to stay intact. It has to do with the membranes. Anemia, B12, that's a big one. So we see kids, ADHD, ADHD, they lack vitamin B12. Dementia, older patients, low B12. It interferes with methylation of mercury, which means it's not helping to detox mercury, which means you accumulate more mercury in your body. Another big one, chronic inflammation. So inflammation in your body has to do with low B12. Diabetes, around 6 million people have diabetes and don't know about it yet. So we think of a dentist, dental hygienists be the first people who suspect it. And as we know, glycemic index of 5.7 or less, this is what we expect to have with the normal healthy people. Controlled diabetes is 7, HbA1c is 7 or less. And the higher blood sugars promote bacteria growth, which in turn raise the sugar level. So it's like a vicious circle. So that's why flossing, keep your mouth clean, so important, even with a just sugar level. Another problem with diabetics, poor circulation. Why? Because the blood vessels get thicker and the less oxygen and nutrients being delivered to tissues. Neuropathy, this is really common. So we'll see patients a lot of times. Those patients are undiagnosed diabetics, type 2. So they will come, women in their 50s, and say, you know, doc, my face, half of my face burns every time I go for a walk with a dog. And I ask, is it every day? Not every day, but maybe 5 days out of 7. We send them to neurologists, we do a CT scan, x-rays, we can't find anything. A lot of times, this has to do with changes in the nerves in the oral cavity. And the minute you get to glycemic control, it just disappears. No burning cessation, no neuropathy. Now, biological office looks at much more than just teeth, which means every time I do oral cancer screening exams, I'll look at the tongue. And this is not new. It's been around for centuries. We'll look at the Chinese tongue mapping. And this is just a couple of examples. I'm going to go briefly here. Clinical depression, insomnia, this 52-year-old woman. I just look at her tongue. I show her the picture and say, you know, kidney area and your heart area is a little red. I'm not MD. I don't diagnose, but I suspect. I bring it up to patients, and then they follow up. A lot of patients that we see, we have a network of naturopathic doctors, osteopath, myofunctional therapists, who refer to Chinese herbalists and acupuncturists, and this is the people who pick it up. And then, yes, they have a diagnosis of clinical depression, insomnia, and back pain, but there's a totally different treatment plan now. We're talking about wind and fire, a lot of elements, and the food and nutrition accommodations. This is another example. This is hypertension, liver problem. You see the tongue? You see how red it is? You see how they inflamed the areas are? This is just a couple of examples. Now, how could teeth be related? Well, sometimes, as you guys probably know, chiropractor, go to chiropractor, you say, my foot hurts, or I have a headache, and then he looks at you and says, it's your spine, and he tries to fix something in your foot, or it's vice versa. You go to acupuncturist with a headache, and you get a needle placed in a totally different area. Why? Because we have energy meridians in our body, and the whole body is connected. So on this picture, you could see, if you can see, it's color-coded. There's organs on one side. There's different areas of spine, and you see meridians. They go in a vertical directions, and some of them go in a horizontal, the level of the spine. This is just a picture of the face and different areas. Of course, we're more concerned about teeth. I brought charts that we use in our office to educate our patients. We're going to pass them around because I know you can't see much on this picture. I don't usually diagnose, as I said, I'm not a medical doctor, and I say, oh, you know, you have this lesion around the tooth number 14. That means you have prostate cancer. No, of course not. Usually it's the other way around. Usually a naturopathic doctor sent me a patient. He said, you know what? We can get a good glycemic control, or we can get patient better with a breast cancer. Can you check meridian on the top right side? There is something there. And I look sometimes at the x-rays. There is nothing, digital x-rays. And I said for 3D x-rays, it's like a cone beam. When I go slice by slice, and yes, indeed, we see there's a lesion. There's an infection. We're going to go over the research. Shows, I think I actually have it here. So Dr. Thomas Roux, as MD in Switzerland, he did a lot of research about the breast cancer. What he says, look at the number, 98% of women with breast cancer has one or more root canal teeth on the same energy meridian. 98%. Dr. Weston Price, as a father of biological dentistry, 1925 he said those root canals are deadly. Energy testing. So the technology makes use of those energy meridians. And there are some points, they're called Wohl points after the German physician named Wohl. There is electroacupuncture, computerized ocular screening, meridian stress assessment. A lot of times patients will come and say, Doc, this is the report. What do you think? My chiropractor thinks there is something wrong with my front tooth. So this is how educated patients are. This is where we need to learn, be open-minded, and research and read. It's much more than we learn in dental school. It's a totally different world now. We need to have a good network of practitioners who we work with. Couple of names. Dr. Wohl, German physician, got interested in acupuncture. Look at the dates, 1940s, before World War II. 80% of all health problems could be directly related to the mouth. 80%. Dr. Kim Bong-Han, what he demonstrated was that meridians actually exist. It's not woo-woo land. They do exist. And what he did, he injected a radioisotope into acupuncture point and showed the flow. Look at the picture. And I want to point out, this is not an artery. This is not the vein. This is not a nerve pathway. This is actually meridian. There's a little bit of explanation of that, but let's move on. Thermography. Thermography, you see all the different colors. Do all cold areas safe? No. Look at this reduced heart function. Do all the warmer areas have problems? Not necessarily. Well, right here you can see early stages of diabetes, but sometimes we have to explore. There's a warm area in my jaw. Do I have an infection? Sometimes yes. Sometimes it just needed another test. So tooth infection, breast cancer again. A 46-year female does a thermal imaging in 2010. She had a mastectomy a year before. In 2009, she was diagnosed with breast cancer. She thought she doesn't have any problems with teeth, and what we realized after these pictures and tooth meridian chart that you probably will see at some point, there is a back molar infection and sort of breast connection. And on this image, you can see the lymphatic drainage from one to another. Another clinical case, root canal, infection, we put heart attack. 72-year-old male in this case, he did all his dental work. He said, I'm pain-free. I've done everything, bunch of root canals. I don't have any issues. I don't have any problems. Goes through thermography, imaging 2 years before he had a stroke. And we find not only 1, 2, 3, 4 areas of infection, root canal teeth that being infected, but also suspected connection between his root canal treated tooth and his stroke 2 years ago. I'm sorry, heart attack 2 years ago. Again, can these root canals be deadly? Can they be source of no problems? Yes, research shows a link between those. And a lot of times it's secondary infection. So think about it. What is root canal? We take out the nerve. The tooth is dead. It's a dead organ. Who do you think is going to be attracted there? Bugs, bacteria, viruses. They will thrive there. There is no immune cells to attack them, and they have lots of food. So sometimes we take x-rays, and I always say, this tooth is root canal. I don't see infection right now, but we always assume it's infected. And then the patient has a choice. We can watch it. We can take it out and try to replace it. We don't have to do anything, but you know there's a possible infection. It's a source of infection. And a lot of times we see secondary infections in the body. Going back to energy, energy cannot flow through the dead body. Energy meridians. Silent, so-called silent infections. So this is where the people say, I don't have any pain. I had root canals, no problem. I have all my teeth, but I don't want to take out teeth. And then you take x-rays, infection, infection, infection. Oh, by the way, I have autoimmune. Oh, by the way, I have pre-cancer or cancer, diabetes. Well, guess what? It starts with infections. Well, there's a research shows how those oncogenes and tumor suppressants being either decreased in amount or genetic enzyme dysfunctions. But basically, all root canals treated teeth, they transmit toxins. Neuralgia, cavitations. Are you familiar with this term? Or it's a new one? Okay. And I forgot to ask, do we have dentists present here? Medical doctors? Okay. I'm sorry, I saw there's somebody raise their hand. Let me start with the picture then. A lot of times when dentists take out teeth, they don't fully decorticate the area, the socket. So let's say there was a tooth here, right? I take out the tooth. If I don't fully, meaning I don't take out ligament is something that holds the tooth in their socket. If I don't take it out, the new bone will not grow. So what will end up happening, this hollow area or hollow cavity of infection and then incomplete bone growing outside. This is called cavitation. And this infection, again, releases a lot of toxins, but because there's also a lot of nerve going in our jaws in all different directions, will also transmit pain. This is another big one. When we have patients who who say, I have pain, I have tingling, I have numbing, I don't know where it's coming from. You look at the x-rays, everything looks good. I had extraction, I took out my wisdom teeth, and since then I have this problem. We send them to oral surgeon to do 3D cone beam CT, which is a slice by slice of every area. It's like an MRI of your body, and we see those cavities. There is a name, we usually use the name cavitations, but if we have to biopsy, it's called ischemic, osteonecrotic, meaning the dead bone, and neuralgia, meaning there is a pain associated with it. This is how it looks. You see, this is a healthy bone. This is how cavitation looks. You're gonna listen more about cavitations in the next presentation. Fluoride. Okay, so fluoride, it's a big one too. A lot of times I have to talk to parents about it. Fluoride is a toxin, in short. But we're gonna go over what it actually does, but that's pretty much it. So think about it. It used to be rat poison at the beginning of 20th century. Then, before, I'll address it. Let me just finish my thought. And then, 30, 40 years ago, ADA made all toothpaste manufacturers put a poison label on their toothpaste if they contain fluoride. And guess what's happening now? There is no food poisoning label. There is not. We say it's safe for kids. Use it for kids. It's good for you. We're going to talk about it, what it does. If it's a quick question, I'm going to answer it. If not, I'll do it at the end of the presentation.
If you know, if there's a fluoride in the water here in Mountain View or Palo Alto?
I'm not familiar with Mountain View, Palo Alto. I know we tried to fight it in Marine, and they still fluoride. Most of the Bay Area is, as far as I know, the fluoridated water. I'm not going to go into political agenda, propaganda, and the vested interest of government. I'm not going to go into that, but let's just concentrate on what it does. There's a lot of extensive research done. Harvard Medical School, Stanford Medical University, high fluoridated communities kids in those communities linked to cognitive problems, lowered IQ. Impaired thyroid function. In 1960s, physicians will prescribe fluoride for hyperthyroid, meaning if your thyroid has a lot of high hormonal level, it's called T3, T4, you will be prescribed this medication, fluoride, to decrease it. Blood sugar. It does increase blood sugar. It decreases insulin level. It has, people who have kidney disease, just because kidney flush fluoride out. If you have a kidney disease, you have a prolonged amount of nephrotoxicity, meaning it's toxic for your kidneys and it stays there for a long time. Increases heart risk. Why? Because aorta accumulates fluoride. It's probably #1 accumulation in the soft tissues. Bone fractures, that's a big one. Think about it. US hip fractures rate, #1 in the world. Hip fractures rate in the United States. Crippling skeletal fluorosis, hunchback. Well, this is more for very high fluoride, I have to say that. But the bone fractures, it's at some point, I can't remember when, I believe in 1956 is also, physicians thought, okay, how about we're going to fight osteoporosis and prescribe fluoride? But what they end up seeing, even more bone fractures. This is when they stopped doing it. And they said, okay, let's just dump it in a toothpaste and let the kids have it. Does it make sense? No, it doesn't. Because we accumulate fluoride in our bones and our joints. We accumulate. It's really hard to flush it, especially if you have any kidney problems. Damages cell DNA, bone joint cancers, of course, because it stimulates bone cells, and lots of them become malignant over time, meaning become cancers. And this is a big one too, endocrine disruption. Why? It decreases insulin, decreases thyroid function, decreases melatonin, decreases testosterone, talking about fertility. Dentistry can be toxic. I like this slide. Mercury, nickel, root canals, cavitation. This is what we're talking about if we take out the tooth and there is still a incomplete bone growth, and fluoride. Mercury, this goes back to amalgam fillings, which was a standard of care. We're still fighting with ADA. Is it really standard of care? Last week, I saw a patient, 3 years old, with amalgam fillings that was placed 2 months ago. What can I say about it? And mom says, I had no idea. They just took the kid. They said the filling is done. She comes home, black filling. She calls, I want to take it out. Now there's a special protocol how to take it out. We're going to talk about it briefly. Tell me about the time. We're good with time because we started a little later. I want to answer all the questions also at the end of the presentation. So mercury, number 3, most toxic materials known to mankind after arsenic and lead. Big one, right? And we have it in our mouths. Well, we used to have it for a long time as a safe filling material. Nickel, talking about crowns, stainless steel crowns, all the ortho wires, all the metal braces, partial dentures. We have it in our mouth. Carcinogenic, suppresses immune system, attacks actually visual areas of the brain. This is a new one, newest research. Copper increases carcinogenic of nickel, but copper also in all the amalgams, and usually they go together. Titanium, implants. Let's talk about implants, titanium implants. Well, first of all, 1% of population is allergic to titanium. We know that. Is it a big number? Maybe not so much. But think about second point. Titanium has always nickel associated with it. So there is no way to make a titanium implant without adding nickel or aluminum. It's just technology of it. Do most people know about it? No. They think it's just titanium. It's never just titanium. It's a hapten, meaning it stimulates immune system. It's always stimulates to a point that your immune system will start autoimmune response, meaning try to fight itself. Titanium implants also influence energy flow. Just like a dead body root canal, there is a titanium implant that will stop the flow and cause release of other metals into the body. This is us. This is us removing amalgam fillings. Yes, this is how we do it. You see the masks? You see how we covered up the hair, the body, special, tell me the name of it. No. It's on tip of my mouth.
Vacuum?
Well, vacuum, of course, but it's also special. There's a negative ion generator, but it's also special filter we use. Let's call it a filter. Patient is breathing oxygen. Hair is covered. Body is covered. Face is covered. Special filters in the section, trying to trap any vapors. Now, sometimes we have patients who are coming from all over the Bay Area who will come to us and say, we're pretty sick. We have metal toxicity. We have a lot of mercury. Like we had a patient a month or 2 months ago with 99% mercury level. It's really high. Can we just sit down and say, hey, let's take out your mercury fillings? No, because we have to make sure the excretory routes are open. So think about it. You're trying to remove mercury filling. It's like cleaning a room without having the door and window open, and there's no way for you to throw out the garbage. So all you do is it's going to be circulating again, so meaning it will come out of the liver in your blood, and then it's going to redistribute in your body. It's going to go somewhere else. We can't do that. We want to make sure the patient has, what are the excretory routes? Liver, kidney, lymph nodes, lungs. We want to make sure we have the way to clean it. We have a special protocols. I'm not going to go into details about that. Detox afterwards, the DTA, IV vitamin C, homeopathics, herbal, rinse with chlorella, multi-mineral complex, multivitamin complex, before and after. Nutrition, big one. Nutrition. Weston Price. 10 more minutes. Okay, I'm sorry. 10 more minutes. Nutrition, eggs, garlic, broccoli, cabbage, butter. We need to get patient nutrition counseling. It's a must. I probably will skip this nice, well, maybe I'll just go very briefly. Patient comes in. How do you like the smile? beautiful. She's actually a dental hygienist. I can be critical and talk about aesthetics and the color, but it's a beautiful smile. Let's see what's underneath. This is what we see. I call it metal ionic soup. So we have mercury amalgam filling, silver, copper, mercury tin. Gold crowns, they will have silver, copper, platinum, palladium. Do you know about it? It's never gold. It's never 100% gold. Let's continue. Titanium. Oh, titanium implants, nice. No, always aluminum and nickel, always. PFM crowns, always nickel, always cobalt, chromium. Root canals, all of those root canals. And on top of it, she also has the ortho retainer, which has nickel. And she says, you know, I have this burning sensation in my mouth. I have no idea why. Do we have understanding? So it's too many metals, too many things happening. And we sent her for what's called Melissa test. It's sensitivity for different metals. Of course, she's high with mercury and nickel. Of course, she has a titanium sensitivity. We have to take things out. We start slowly. I usually say, let's just take just one thing and see how you feel. I'm not necessarily saying, let's move the whole thing out. New tools. So what we actually do in the office that's different. Ozone. Are you familiar with ozone? Yes. Okay. Okay, so we can go over this section a little faster probably. So ozone is activated oxygen. So it's all three molecules. It regulates immune system, stimulates interleukins, growth factor. It basically breaks down the cell membrane of viruses, bacteria, and fungi, which is amazing. It also induces antioxidant enzymes, stem cell activator. Where does ozone come from? Really briefly, when UV coming from the sun makes contact with the oxygen and atmosphere, this energy comes from O2, becomes O3, so-called ozone layer, which actually protects Earth from UV rays from sun. So this is a natural one. We don't use room air for ozone generation because it has nitrogen. We don't need nitrogen oxide. So we use ozone generators, meaning machines that are hooked up to medical oxygen. And I'll show you on the picture. Tubing must be latex-free. So how we can apply ozone? Rectally, vaginally, ear insufflation in the office, nose insufflation, injection in the bone, actually gassing, meaning superficially going around the teeth and the gums. There's also ozone saunas. Uses in dentistry, oral surgeries, joint problems, sensitive teeth, cavities. We use it for everything. We use it for every single procedure. And patients who are coming to see hygienists, they also use ozone. And this is how it looks. This is not what we have, but this is one of the ways. It's just a little cup that that will just get the ozone to the tooth. There's also those mouth guards, and this is the one we have. It's a medical grade ozone generator, and the little tip. Air abrasion, truly minimally invasive procedure. Aluminum oxide is being just poured with a little pressure, and it's usually used for remove small areas of decay. We don't need to get patient numb, and it's very selective. It removes only infected dentin and enamel. Lasers, full range. You can do hard tissue, cavities, crown preparation. We can do soft tissues, gum disease. Extremely precise. Extremely precise. We just got a new laser, actually. It's another big one, sleep apnea, and what it does, it tightens by the contraction of collagen, oral mucosa tissue, less snoring. Patients are happy, wives are happy, husbands are happy. Easy, no pain, no blood. Obviously, frenectomy, meaning tongue tie releases, leukoplakia treatment, and facial aesthetics. So we're against all fillers. If you have some wrinkles, we'll rather use laser energy to fix that. Exosomes, big one. Exosomes is just part of a stem cells that has all the information. It's called extracellular release components of stem cells. We inject it, we just recently started actually. We inject it in the tissue for regenerative properties. Let's say, I need 5 more minutes. I'm just gonna This is a really good one. I think this is really public should know about it, because a lot of times people will say, you know, this tooth hurts sometimes, but sometimes it doesn't. Can we save it, or do we still have to send the person to do a root canal, which is irreversible, right? If we can inject something in this tooth while it's dying or being inflamed, I mean the nerve side, such as stem cells, can we revitalize it? Can we do something about it? This is where we're working on. This is what we're doing, and we're just starting. It's been used in medical field for a long time, but not in dentistry. So this is what really our hopes are. And right now we usually take kids, young adults, and we have good results. So kind of next step to use it on adults. Peptides. Peptides, it's like insulin, let's say. It's a short amino acid peptides, amino acids. And they have anti-inflammatories. So specific ones we can ask the lab to send us. They usually send it in a powder. We mix it with the sterile water and inject it. Inject it in bone, inject it in gum tissue, and wait for it to regenerate. So the whole approach, everything I talked about, it's all about having specialists that you can refer to for testing, to follow up, to talk about different approaches, nutrition counseling, how's the pH in the mouth, should we raise the pH, let's start a different diet. It's integrative approach. Naturopathic doctors, chiropractors, osteopaths, myofunctional therapists, ENTs, we have to have a network who we work with. And of course, my favorite, all truth passes through 3 stages. First, it's ridiculed. Second, it's violently opposed. Third, it's accepted as being self-evident. I love it. It is so true. Thank you for your attention. I have some questions right now. We can do it towards the end.
Why don't we go ahead and take questions now?
Okay. Yeah, tell me the timing, though, how much I can take. Yeah. Hi.
So if somebody has root canals, what do you do?
Okay, that's a good one. We can talk about it for a long time. So if you have a root canal, well, first of all, ideally, I send you to this cone beam CT, meaning a 3D X-ray. I want to see what is happening. Do you have any infection right now? Or it will be one of those things that we're going to be watching. I want to make sure your naturopathic or medical doctor knows about it. You have potential infection. How's your prostate? I mean, it's not directly to you. Do you have any autoimmune disease? Is there anything in your body that suggests there is inflammation, there is a toxin release? So let's say you don't have anything. I said, we're going to watch it. So next time you come for a cleaning, I'll take another look. I'll test it. I'll ask you to do another X-ray. Scenario number 1. Scenario number 2, we take an X-ray, there is an infection. You have to take it out. You have to take the tooth. If there is infection around the root canal treated, you have to take it out. Otherwise, it will create secondary infections in the body. Imagine if it's an open wound in your body and it's releasing those toxins, as I said. There's no way you can avoid degenerative or autoimmune disease. This is what we see all day long, unfortunately. Sure.
I was intrigued, you talked about ozone in the ear. What would you do that for?
Patients will come and say, I have seasonal allergy. Can I have 20 minutes of ozone? Our patients know what ozone is, right? And they already do it all, for different purposes. And they do know ozone insufflation will go through all the sinuses. Sometimes patients are like, oh my God, I feel so lighter. I had a patient say, I feel so, my creative chakras are open. So everybody's different. But some people say, oh, finally, this congestion, this heaviness is gone. Some people feel, even today I had a patient who said, I have a sore throat, or his wife actually called and said, I had a sore throat, or my wife has a sore throat. Can I stop by for ozone really quickly? I said, yeah, sure. Just sit down in the hygiene room and do the ozone through the ear. It takes 10, 20 minutes.
So is there an alternative to implants, or do you just recommend no implant?
Yes, I talked about titanium implants. There's also zirconia or ceramic implants, just like a white ceramic crowns. There's also ceramic implants. Is it ideal? No. Is it better than titanium? Definitely. It doesn't irritate the immune system that much. It's not autoimmune. It's not a hapten, basically. This is what we use. This is the only This is the only implant system we use in our office in network of the providers that we work with. Only zirconia implants, ceramic implants.
Does the cavitation recalcify?
Cavitation is a hole in the bone. There is no way for immune cells or blood cells to come and get any minerals there. No, it's a hole there.
And it's permanent.
And the bones try to grow, but this ligament doesn't let it. So that's why it's always hollow, and there's always bacteria there. Oh, it's like a pus inside. It's we call hollow, but it's a pus inside.
What's the difference between a biological dentistry and functional dentistry? And are there any of either of those down in the, south of San Francisco?
The colleague of mine, Dr. Eric Zaremski, probably you know him, but he will know better. I'm not, the second part of your question about South Bay biological dentists, I don't know. We can look into that. I can get back to you. I mean, I can. Oh, here?
Okay.
Here? First part of your question, it's the same thing. We sell functional, integrative, holistic, biological. I use them interchangeably. I'm sorry, I'll go with the first row first.
You can't just inject ozone into that cavitation and have it.
I can, but then it will kill the bacteria for this period of time, but then it's not going to heal it. In order for it to heal, I have to get a new blood, it's called capillaries, new blood cells, and then new bone cells get inside. I can sterilize for a certain amount of time, but then the bugs will come again.
Okay.
So it's like doing something that every day.
How much do you charge for 20 minutes of ozone?
Not much. $140. Are we doing it reasonably? Yes, we want patients to know about this modality. We're not trying to do something that's extremely expensive. Nobody can afford it. Yes.
So if someone's been told they need a root canal, what is there other than the root canal?
And by the way, before answering your question, I'm not saying all root canal, you should never do root canal. I'm just saying if you have to do it, let's say it's a young woman, it's a front tooth, and she has to do it for right now. She cannot afford to do implant. We'll say, okay, do it. Do it with a person who uses ozone, just to make sure at least you clean all the bugs there. And then we're going to be using ozone injections every 4 or 6 months. You come for your hygiene appointments, for your cleanings. And then we're buying you time to get ready for your implant or for your bridge. Now, answering your question. So you mean if not to do a root canal and not to take out the tooth, what else to
If
do?
someone's got, like, the tooth is hot, dentist said you're getting a root canal. Is there anything that you can do?
This is the beginning. When you say the tooth is hot, this is the beginning. Meaning there is inflammation. I know. There is an inflammation. It's still inside the tooth. It's not where it's coming out and there is a huge lesion in the bone when there is, no, it's dead already. So this is the time where we are using stem cells. We're injecting them. And we're hoping, because it's still a process, we're still learning. I'm still learning. We're just starting to use it. We're hoping for your immune system, immune cells, because it's still organ, it has a lot of blood supply, right? A lot of lymph drainage. We're hoping for immune cells to get there, get all the bugs, and we help you with ozone injection, we'll help you with the stem cells, and regenerate. Because if you do it once you've done with root canal, that's it. There is no...
Needs to be done. Is there anything that you would do to ensure that it doesn't end up with the whole sequelae?
Well, yeah, so a lot of times patients will come and say, I do know I need a root canal, but can we do something else? I said, we can try. I don't know if we can still avoid it, the root canal or extraction, but we can try. A lot of times it helps, sometimes it doesn't. Well, people with Lyme disease and cancer and a lot of things that medically compromised, of course the lymph nodes is not, lymphoid drainage, not helping much. Do you know what I mean? So a lot of times it has to do with the medical history, with the clinical situation itself. I need to let other people speak too. But I'll answer the...
This is just comment. So there was a German study I heard of where they pull teeth out of like 1,000 non-symptomatic people.
Root canal to your
Yeah,
teeth?
root canal,
Yeah.
and
We had it here in States too.
99% of them were infected.
Yeah.
So if you've got
Yeah.
a root canal, chances, I actually
Yes.
have one and I keep it under control by getting regular ozone
Ozone
injections.
shots. This is what we have. Some patients still have to keep it. Do me ozone. They come on monthly basis or weekly basis to do that. And some will say, no, I can't
Yes.
afford it.
So thank you so much, because.
Yeah, I'll answer more questions at the end,
And you'll be around,
if we
people
have
can
time.
say, there's so much going around on in dentistry right now, like, I had a root canal maybe 10 years ago, and now, the same case, you might save the tooth, right? And-
We're
and,
hoping.
Hopefully,
We're
so
hoping.
there's so much going on, it's
Yes,
really exciting.
it's
Thanks
changing. It's
thanks
changing.
for letting us
You're
know
very
about all
welcome,
the
and I'll try to
various
answer more
different-
questions. Thank you.